Hi guys, today we are going to be working on our second lecture of two on medical terminology dealing with prefixes and suffixes. This is an illustration of a prefix going in front of a root and a suffix being added on the back of the root to complete the complete medical term. So we need to be able to define a suffix and a prefix, gives examples of how suffixes are used, recognize and apply some of the general noun, adjective, and plural suffixes used in medical terminology, identify and define how some of the prefixes and suffixes are used in medical terminology, and lastly, analyze the suffixes and prefixes used in some case studies. A suffix is a word ending that modifies a root. It may indicate a noun or an adjective, and it determines how the definition begins. In this case, we have a root of myelo, which refers to bone marrow, and oid being the suffix. The word is myeloid, is like or pertaining to bone marrow. Another indication using the same root, there would be myelo. Oma being the suffix is a tumor of the bone marrow. So by changing the suffix, you change the meaning of the word after attaching it to the root. Suffixes can convert roots into nouns. The ending sis may appear with different combining vowels, be osis, iasis, esis, or asis. These are examples of suffix that mean condition of, ia, as in dementia, condition of loss of intellectual function, ism, racism, discrimination based on race, cis, thrombosis, is a blood clot in a vessel, and atony, is a lack of muscle tone. These are some further examples of suffixes in medical specialties. Ian, as in physician, is a specialist in medicine. Iatrics, as in pediatrics, study of children. Iatry, as in psychiatry, study and treatment of mental disorders. Ix is a medical specialty, orthopedics. Ist, podiatrist, is a specialist in study of the feet, or pod. And logi is a study of, as in physiology, which is what you were doing right now. You can have adjective suffixes as well. Adjective endings meaning pertaining to, like, or resembling include the following. There's ac, as in cardiac, form, as in musiform, ori, as in respiratory. And there aren't rules in these adjective suffixes for use with a given noun. So pertaining to, like, or resembling suffixes, as we said, ac, al, ar. A new one, pertaining to a nucleus, airy, salivary, form, musiform, anatomic, pertaining to anatomy. And here are some more examples of pertaining to or like. Ical, electrical, ile, virile, oid, lymphoid. All of these are pertaining to. Circulatory and us, cutaneous. These are all pertaining to whatever root you're giving in front of it. You can have words that form plurals ending in a, carry a plural ending of ae, gingiva versus gingivae. Gingivae being the plural. And is can also carry a plural ending, diagnosis, and diagnose, ease being the plural of diagnosis. So there's always exceptions to rule. The plural of sinus is sinuses, virus is viruses, and serum, plural of serum is sera, or sometimes serums is also used, but sera is the most commonly used. Plural endings include the following: a, en, ix, ending in x, is, ma, nx, on, and us. And the plural ending would be vertebrae of vertebra, lumen, lumina is plural, matrix, matrices is plural, es, diagnoses, and on through the rest down to thrombus is one blood clot. A thrombi would be several clots. And phalanx, this one you'll see, is a finger of the bone, or a bone of either the finger or the toe, and phalanges is a plural of phalanx. So let's move on to prefixes. A prefix is defined as a short word part added before a word root to modify the meaning. For instance, you can have uni, meaning one, and lateral being the root, a unilateral affecting one side. Another instance would be contra, or against. Lateral being the root, contra or against lateral is the opposite side. So prefixes for number, we have prime for first, mono for one, uni for one, hemi for one half, semi for half or partial, bi is twice, di is two. And these are examples of each of those with those prefixes added. So more number prefixes. Diplo would be double. Tri is three, tricuspid. Quad is four. Tetra is tetralogy, a group of four. Multi is many. And poly, also many. And you all have access to these slide decks if you want to go through and look at them at your own pace. And you can also pause this at any time and take a look at them as well as you're working through your homework. So prefixes for color. So cyan or cyano is blue. Erythro is red. Leuco is white. And you will see these quite frequently throughout this class, these color ones. Melano is black, and xantho is yellow. So really keep these color ones in mind as we work through. So negative prefix, a or an means without, anti is against, contra also against, and D would be a loss, as in to decalcify, remove the calcium. Negative prefix would be dis, would be removal or separation, as in dissect, in, as in not, incontinent means not able to control excretions, usually urine or feces. Non, not, and un, also not. Non-contributory and uncoordinated. Direction would be as follows in prefixes. Ab is away from, ad is towards, dia is through, as in diarrhea. Per, also through, percutaneous, the root is cutaneous, through the skin, and trans is also through. So these prefixes integrate how much of something, as in hyper, an excess, hypo is under, aligo is a few, pan would be all, and super is an excess, supernumerary, an excess number. And you'll see hypo and hyper and hypoglycemia in conjunction with blood sugar when we get into looking at diabetes. Size comparison, equi would be equal, equilibrium, u or normal or good. Hetero is different. Heterogeneous, two different materials. Homo is the same, as in homograph would be tissue transplanted from one species to the same species. Iso is the same, and macro is large. And more for size comparison on prefixes. This one you don't see that often, but poikilothermic, having variable body temperature. Pseudo is false. Pseudoplegia would be false paralysis, plegia being paralysis. And re is back again as in reflux or backward flow. And time and position prefixes, ante is before, pre also before, pro before, and post behind. And prefixes for position, dextro, you're talking about right, sinstro is left, and the root behind that is kind of interesting. In the medieval times, sinstro, or people who were left-handed, were thought to be possessed or evil in some way, so they had the root of sinister. So left-handed people or sinstro people were considered to be in league with the devil. And only right-handed people or dextro were not afflicted with spirits. So sinstro for left-handed. Ecto, outside, and exo, also outside. And more prefixes for position is endo, within, meso, in the middle, synth is together, and tel on the end. And the last phase of cell division is telophase in mitosis. Okay, so I know we went through a lot of material in a hurry that time, but it was also an awful lot of just going through these terms, and I highly suggest you pull up the PowerPoint and have free access to those as you're working through the homework, and before you know it, these will be second nature. Thank you very much.